everybody. Good afternoon. I'm here with Dr. Wall. We're very glad to have you join us today for this panel of a reality check in careers in hospital medicine and primary care and what they really look like with this phenomenal panel. Um, I'm here with Dr. Wall, who's going to introduce her the event, and then we'll move forward.
Great, thanks, Agostina. Hi, everyone. I'm Larry Wolf. I am the chair of the NYACP's Resident and Fellow Committee. And thanks to suggestions of Agostina and some of the other members of our committee, we decided to move ahead and do this webinar series directed towards residents and medical students or anyone who's interested to learn more about careers in hospital medicine and primary care. We know that there are lots and lots of pressures on residents to make decisions in their early in their training about what they want to be when they grow up. And I know it's often very confusing, and there's pressures to go into fellowship and all these kinds of things. And we want to help give you clarity about what it would mean in your life and career to be a general internist, either working in the hospital, in the clinic, or both. So we have assembled a panel of hospitalists and primary care docs who work in various different communities to speak with you about their careers and what it feels like to them to be in that career. Um, so we just so you know, this is being recorded, so your friends who you tell how great this was, they can watch it, or you can watch it on repeat later on from the NYACP website. And just to give you we're going to do two more of these sessions this year. So this is the one about what the careers are like in these areas. Over the summer in June, on June 17th, actually it's still the spring, we will be doing one with a similar panel talking about how to look for a job in those two fields. And then in the fall, we'll do one more directed on September 16th. That's going to be one more directed towards the process of actually like signing on to a job, looking at contracts and all that kind of stuff. So we're hoping that this series of webinars will be really helpful to all of you as you navigate the choppy waters of trying to figure out what you're going to do when the protections of residency are gone and you're out in the real world. So without further ado, I'll hand it back over to Agostina, who is a PGY3 resident at Mount Sinai Morningside in Manhattan, and she's going to be the MC of this panel, and she'll introduce our panelists and get things going. So take it over.
Thank you so much. So today we have four wonderful panelists. We have Dr. Raphael Rabinowitz. He is an academic hospitalist and clinical assistant professor in the Department of Medicine at NYU. We have Dr. Alison Koransky. She's an academic primary care physician and assistant professor of medicine at the Icahn School of Medicine at Mount Sinai. We have Sravan Ponnekanti, who is a community and chief hospitalist at Guthrie Corning Hospital. And we have Bailey Perry, who is an academic primary care physician and assistant professor of medicine at Icahn School of Medicine at Mount Sinai. Thank you so much for joining us. So we're going to start with Dr. Rabinowitz and Dr. Perry. And I wonder if you can tell us about how your day-to-day workflow is, either as an inpatient or outpatient physician, and if you can comment on your schedule, and how those roles work out for you.
Do you want to go first, Raphael, or?
I'll go first. Thanks. So I am an academic hospitalist. I work at Bellevue Hospital, which is a public hospital, and then have a academic affiliation with the NYU School of Medicine. So day to day, my schedule varies, but I do on average, about 16 weeks of clinical service a year, which is, pretty intensive, showing up to the hospital around 8 in the morning and leaving around 5 o'clock, constantly seeing patients, working with residents and PAs. And then I also have a lot of other roles within my hospitalist group. So I'm the nocturnist director. So I do a lot of administrative work with faculty development around that. I'm actually starting a role as an assistant faculty development director. So, kind of working one-on-one with new faculty to develop research projects. And that's also sort of administrative work. And then I also teach residents that rotate through our medical consult rotation, kind of like rapid response code management, medical consultation, and then also teach point of care ultrasound. So those are sort of my clinical adjacent interests. And so, I get a variety of different things, but generally speaking, my busiest time is on clinical service with a lot of flexibility built into administrative work.
I work at an outpatient clinic, Mount Sinai Doctors in Green Lawn, which is Long Island. My day-to-day doesn't vary too much. I would say that I work similar hours to Raphael, pretty much 8 to 5. I start seeing patients at 9 on Mondays and Tuesdays. Wednesdays, I have a little bit of a later day. Thursdays, Fridays, I do 8 to 4. So it's nice outpatient. You can be a little bit more flexible with your schedule on the day to day. Obviously, inpatient is a little bit different. I see follow-ups and annuals mostly, not really so many urgent care visits, but Tuesday afternoons, I've built it into my schedule just to have some acuity. So for annuals, it's 30 minutes you get per patient. For follow-ups, it's 15 minutes. And you can kind of do that interchangeably. You can do all your annuals in the morning, all your follow-ups in the afternoon, kind of whatever works for you. And I don't work with residents. I decided that I don't want to do education, and so my clinic doesn't work with residents. But yeah, that's pretty much my schedule. In the outpatient world, I feel like there's a lot of flexibility with what you want to do and how you want to schedule patients. So that's really nice. So if you wanted to spend longer in the beginning of your day when you have more stamina, you can do your annuals then. Medicare annuals take forever. And in the ending of the day, you could have your follow-ups, which is nice because then it's just quick, and you know the patients. Obviously, starting out when you're new in the practice, everyone's going to be new and it's going to take a long time, but that will start to pick up. So that's just my schedule.
Thank you. And it sounds like both of you have, right, a combination of activities, and that probably that role will change through your practice and once you're more settled. Thank you for sharing that. Now I'm going to turn it to Dr. Ponnekanti and Dr. Koransky. What advice do you have for residents choosing between primary care and hospital medicine?
You can start.
Good. Yeah.
So two things that I think about like when I was like deciding what to do with my life. So one thing is I went into residency being like, I'm going to be a primary care doctor. And then I did residency and I was like, I can't be a primary care doctor. All I do is spend time in the hospital. Like, how am I possibly supposed to be a primary care doctor? And like felt really lost when applying for jobs because I had like such a clear vision before I started residency. So I would just encourage you, like, just because you're more comfortable in the hospital, if you do really like primary care or that's what you saw yourself doing, like it is okay to take a job where you're not most comfortable. And unfortunately, like internal medicine training is so much inpatient that I think we are a little less prepared for outpatient, but that doesn't mean you can't do it and shouldn't do it. And you'll learn a lot when you start. And then the other thing is that at one point I was asked, like, how do I feel about nights and can I do nights in 5 years from now? And not every hospice job has nights. And some primary care doctors get a lot of calls at nights. I don't, but some do. And that made me be like, I hate nights. I am miserable. And like, I'm not my best self at work or outside of work. And made me really think about like, okay, what do I value on my day to day? Because I think it's your first chance to think about like your life as a whole and not just your life at work. So it's okay to make choices that set you up to like your life as a whole and what you like and do as a person.
So, I agree on what Dr. Koransky said. As an internal medicine resident, at times, if you're in the first year, it can be overwhelming as to what you have to choose because, they say you have to apply for fellowship if you're interested. You have to choose for, as progress in the residency, you want to choose between primary care and hospital medicine. So one thing that as of course, I had, mentors and also seniors guiding me. But one thing that stuck my mind always is what kind of person are you as you develop from PGY1 to PGY3? Are you someone who like fast-paced environment, like where you want to do some procedures, like as Dr. Karansky said? Are you someone who are flexible, you want to do nights? Because as a community hospitalist, we work 7 to 7, but at times when some family member had an emergency or the night hospitalist is unable to come, probably if you're off, you have to step up and take that role. So are you someone who can have that who can step up to that is something you should keep in mind. And I think in my case, I like doing some procedures too. So that is what I kept in mind as I chose between when I'm signing for the job. And in the hospitalist realm, you would see more of acute patients, right? Hospital. Whereas in the as a primary care, you kind of maintain that continuity of patients and more focused on the preventive care. I like one of my colleague put it in the ways that as a hospitalist, you are the point of contact. Like in my community setting, patients have low health literacy, and when a loved one comes in with say hematuria, and you have to consult all the subspecialties and you have to work them up, and the family and the patient itself is not knowing where what's happening. So you being that person, the point of contact to make sure that they are understanding the plan as they navigate the hospitalization is something, if you're comfortable, that is something you would want to take up as a hospitalist.
Thank you for sharing this and how commenting and how right our personality and our priorities really shape the decisions we can make for the next steps in our career after residency. Um, Dr. Perry and Rabinowitz, can you describe how you balance work and life and work and vice versa, and if you have any burnout prevention strategies?
That's a good question. I specifically to outpatient, I think it's really nice that we have weekends off. So you work 5 days, you're working like a 8-hour workday, and then Saturday, Sunday rolls around and you're like, oh my God, yay, I can do whatever I want. Except when you're a little bit in your head and stalking haiku, which is like epic on your phone at like 3 a.m. on Saturday night, but that's besides the point. So I think that it's really nice to like tell yourself, okay, I have to go to work from 8 to 5. Before that, I'm me. After that, I'm me. And then I have these 2 days every single week that I can do whatever I want. That feels really nice. I also think it's important that you know, balancing work life is also making sure you're happy at work. So choosing a career in which you're going to be really happy and love to go to work every day is it's ideal. And if that means inpatient and working like fast paced, that's great. If it's outpatient, it's a little more slow. You get to like twiddle your thumbs, think about things for a couple of days, then call the patients after that. That's great too. But just making sure that you're happy both at work and at home is going to equal the best work-life balance, in my opinion.
So I have a 15-month old daughter, and honestly, I thought being a parent would ruin my work-life balance, but paradoxically, it's actually made it a lot better. I think when I started out my career, I was somebody that was, staying late, didn't really know how to say no to things. Like, would do it basically, anything that was, suggested to me, I would take on, even if it wasn't really an interest of mine. And I think having a child has sort of made me more comfortable saying, I got to leave it by 5:30 so I can get her from daycare, and being kind of firm with that and not bringing work home so I can be with her. And as a result of that, it's kind of streamlined my approach to work-life balance, where I certainly still do, as I mentioned, a lot of clinical adjacent activities and have a lot of like niche interests, and that's what I think is great about being a hospitalist. But it's helped me pare down those things and focus on what actually is good for me, what really, piques my interest. And as a result, has kind of made it so that I just have a focused approach to things that I really like and enjoy, that bring me joy, that helps with burnout too.
Good to hear that the words like happy, joy, family came up, right, as and even hobbies is part of like maintaining this work-life balance. Thank you for sharing your experiences as well. Um, so Dr. Koransky and Ponnekanti, what are your career flexibility and advancement opportunities in your roles?
I can start. So I am at the hospital-based clinic where the residents rotate through. So I'd say like with like career opportunities, my schedule like today is very different than the schedule when I started work. So I like now have time bought out to teach the quality improvement curriculum. And I have a lot of time bought out from the medical school to teach the doctoring class. And I'm like in my third year here. So I don't like that's not necessarily like advancement of like promotion, although like it is down the line will help with my promotion. But I found that like I'm in a place where as things come up, it's like offered out to usually multiple of us of like, hey, did you see this? Did you see that? That makes it easier to apply for these other positions that take away some of my clinical duties and like make my day a little bit more diversified. But I'd say like Sinai itself has like a very like structured promotion pathway as most academic places do. So you have to do some stuff for that, but I found that I just do stuff that makes my day more enjoyable.
So coming to me, that's what I like, the beauty of Hospitalist. You sign up as a 7 to 7, morning 7 to evening 7 role, 12 on, week off. But there is also, it depends on, place where you're going. As a hospitalist, you also have shifts called a swing or, admitter shifts, or of course the night shift, which is, work on 7 on as a nocturnist. But coming to the, in the day itself, you can do something called as admitter shift. Like, let's say you're rounding and the teams, team A to team B, sorry, team D, like you have 4 teams. The community, the hospital where I am, we have 4 teams, and you're busy. You just call one of your colleague to come and help in the admissions. So they come evening, noon to 6. You can do that, just that shifts. There are some places where they offer you when you're signing up or looking for jobs, just that admitter shifts. You come in at noon and go at 8 in the evening or 6 in the evening, depends on what your what you want and what you're looking for the job. And the swing itself can go anywhere from morning 7 to evening 5, or morning 7 to evening 10, depends on the places you're going. As I said, there's a lot of flexibility. You don't have to stick to 7 on 7 off as the norm. One of my professors here when I was a resident, he used to say, back then in 90s when he just moved in here and started his job, there was nothing as hospitalist. So this role came on in the early 2000s. So now as we even become more sophisticated and become more complex in the healthcare realm, as a hospitalist, you have multiple opportunities, to do whatever you like, 7 on 7 off, swing, admitter. And there's also flexibility in terms of like administrative. You want to do a 1 year fellowship as a hospitalist, and go on for just be focus on the quality. Like you become a member in the committees, sepsis committee, stroke committees, quality metrics. You can be you have limited clinical role in that sense. Like this is all from my experience at a community hospital. At academic settings and at a bigger city hospitals, it might be different, which my co-panelists are advising you. As I said, here, you just work 6 hours a role as a clinician, and then you focus on the metrics and, try to improve those. That is something also, you can look into when you're looking to for your jobs, when you're in PGY3.
So I think it must be really interesting for all of us to hear what else is out there, right? Because I don't think we often have a chance to hear attendings share about this, all these other opportunities. So learning about committees, looking out for academic promotion pathways. I think it's good for us to be educated on that. So thank you. Okay, so now I'm gonna also offer everybody listening, please feel free to add questions to the chat. We're gonna have a Q&A at the end. But if you have any questions that come up as you hear the speakers and the panelists, please write it down. So now I'm curious for everybody, what do you really love about what you do, and what do you find not so great since you've been working in this position?
I can start. So I work at a public hospital, so I think just the mission of what HHC, which is Health and Hospitals Corporation that Bellevue's a part of, is what really draws me to the work. I mean, I think we take outstanding care of patients, regardless of ability to pay. Many of our patients have very low health literacy, as was mentioned by a fellow co-panelist. Many of them have never seen a doctor, are coming from other countries, and just like the quality of care that we give, the dedication of the staff. It really makes me happy going to work every day, especially in times like these. As far as the things I don't like, I actually changed careers. I used to work at a different hospital, which I won't name here, but one that had a more, let's say, corporate orientation. And I think a lot of the burnout I felt there was related to sort of administrative pressures, people that were non-clinical, kind of questioning medical decision making and practices that were doing that, maybe weren't fitting sort of their algorithmic thinking, but they weren't necessarily, coming from medical backgrounds. And so, one of the reasons I moved jobs is because, well, I do think like quality improvement is important. I think like at least my hospital does a good job of sort of getting a lot of clinician input before implementing sort of quality metrics.
I think I can piggyback off of that. I think I'll start with the bad about my job. Similar to Dr. Rabinowitz, I think, well, I guess in your old job, similar. Just having like corporate medical health kind of circling around your day to day, just like notes and billing and having the stress to like practice medicine in a money hungry way sometimes, which I think is a horrible downside to our health system. But on the other side, the best part about my job is like really just caring for patients and becoming like a part of, I know it's like cliche to say, but like a part of their family, like just traveling with them through life. It just is so rewarding. And I think one of the best parts of my practice is that I see families. So I'll see like the kids in college, like the 18, 19-year-olds, I'll see their parents, their grandparents. And that's really cool. And that makes me really happy. And that's something that I needed in order to kind of do this. So I think it's really important when you're thinking about what you want to do long term is, do I want that? Do I want this like longitudinal relationship, or do I want, I guess hospital medicine is a longitudinal relationship, but like in a shorter period of time. So it's just like just different, same but different.
Going along with what you said I think like the relationships that I've built with my patients like really makes my job really enjoyable. And like it might be a really busy and hectic day, but like when I'm in the patient room, like I now know my patients, I know their family members, like it feels like a lot of times I'm just having a conversation, which I really like and have found to be rewarding. I also really like that every single one of my days is different. And some of that has to do with like the other activities that I do, but like today is the only day I see my own patients all day. And like tomorrow I'm going to be teaching all day and the next day I'm with the residents. And it has allowed me, I think, to enjoy each day of its own instead of like being like, well, now I have to do this again tomorrow. Like I'm just like, I just have to get through Wednesday of my own patients and tomorrow it's something totally different. So I like the fact that I have such diversity. The thing I don't like about my job, or I think that's challenging is like our inbox like doesn't go away. Like today while I was seeing patients, I had like critical labs coming in, people's blood pressure's out of control. And like I want to be present for the patient in front of me, but I also have to make sure those patients at home are safe and going to the hospital appropriately. So figuring out how you can make sure nothing falls through the crack in a busy clinic day is a thing to learn, but also like definitely there'll be times I'll be like, I need to wrap up this physics. I have to call this person and my next person is here. And like, how do you make sure that you don't let that show to the patient? It can be challenging.
So, as a community hospitalist, I would say, the joy of knowing that, my one of my nurse, I did my residency in the same system, and I just, became an attending here. In my first years of, as a PGY1, one of my nurse asked, we were on a palliative care, home visit, and one of my nurses asked, Dr. Ponnekanti, you want to go to shopping? I said, sure. It's 10 o'clock in the morning, bright sunny day, and then it's like shopping here. And she took me to Walmart and said, this is a shopping place we have. And, the irony was, you go for, and she used to say, you go 4 days straight in the Walmart and you will bump into one of the patients you see in the clinic. So that saying that aside, my point was, you kind of know everybody here, both the staff and the community. And as a, the where I'm practicing is a 70-bedded small community hospital, but in that, sometimes you have, I would say, the autonomy. Like when you see a patient, you have to make a decision right there and then that can, change. Like you have to transfer the patient, or you are trained as a hospitalist, but you might sometimes, have to do emergent thoracentesis because the patient is really short of breath. You can't wait for IR to come and do that. So kind of you have a lot of say in caring for the patients, and less bureaucracy, of course, with the higher ups just monitoring you, but they're not there to say, hey, you need to improve this metrics, you need to improve this length of stay, things like that. So less bureaucracy, knowing everybody out in there, both the hospital staff and the community, is something what I love. What I don't like is lack of that academic stimulation, and not able to work with the residents and fellows. I like teaching. We have small the nursing colleges and students that come here. I kind of teach them, but I like to really work with the residents and fellows, which is lacking as a community hospitalist. And some, as I said, resource limitations itself. Sometimes I have a patient in the ICU where I have to, he's seizing. I know I have to get an EG, but lack of resources I couldn't get, and I have to reach out to even bigger places, Thomas Jefferson, NYU, and I have to keep calling. So that is something which I don't like, but I think pros and cons of every job, as my panelists, co-panelists are sharing. You have to choose, what you love is more. If you like more than what you not, then probably you'll stick to that.
Thank you. I hear some common threads here, right? How, I mean, in your job, you can have really different days and that will make it exciting, but how some burdens kind of apply to the medical system, regardless where you are. But at the end of the day, right, loving your job really makes, gives you the strength to power through. Um, so now that you're in this position as attendings and a few years into your practice in each case, what do you wish you knew as a resident? Any piece of advice?
I think I wish I knew all the possibilities out there. Like, there are just so many things that you could go into as an internal medicine physician. And I think that when we're like nearing the end of residency, like the goal is to just get a job. And in my head, like training in a hospital for 3 years, being like sleep deprived and just like anxious to like sign this job and like start working and like start making money finally. Like you kind of just have like tunnel vision and you're like, okay, I can either be a primary care physician or I can work in the hospital. Like it's outpatient or inpatient. And I feel like there's a lot of gray area. It's not just black and white. And so it's really important to like keep talking to people like attendings or just like doctors out in the community at like what do you do, what does your daily life look like, what's your schedule, how many hours do you work, is there admin time where you can just spend doing like spend the time doing paperwork or getting back to patients, reviewing labs. Are there nurses that you work with? Are there medical assistants that you work with? Where do you work? What type of setting is it? I didn't realize that like some clinics are going to be associated with residents and some clinics are just going to kind of be like private practice, but a part of like a bigger health system. So there's just like a lot of the nitty gritty details that no one tells you about that I think is really important in making a decision on what you want to do for basically the rest of your life.
I completely agree with that. I think, thinking about, I think there was a comment in the chat about kind of like approaching the job search. And I think to Dr. Perry's point, when we took these jobs out of residency, we were sort of at the end of our wits' end, just ready to start our lives. And so I think you kind of get tunnel vision and don't always think about, how is this place going to fit for me? And I'll just let you know that like for me, it was even though I was able to transition jobs relatively seamlessly, I always felt kind of strange going to a place and only working there for 2 years and then switching jobs to the one I'm at right now. I think there's some psychology about, the loyalty you want to give, you want to show to a place. And so I think it is important to really do a good due diligence, exhaustive search, and search yourself about what's a good fit for you. Because in retrospect, I think the job I took was something I was very willing to do. And to be fair, like I finished residency during the first wave of COVID. So I was just like, I can do this. Like everything's locked down. So sure, I was like a full-time nocturnist, which is something that, though I am a nocturnist director and I do like doing some nights, was just not going to be, possible for me long term. And I didn't really explore like if there was opportunities to work during the days at that other place. I didn't really think about how I would see myself at this place 5, 10 years down the line. And I think that's really important. You kind of just probing yourself about whether your job is a good fit, because it is kind of a good opportunity to pick and choose a lot amongst different options when you first start.
I would just also say like along the similar lines of like I did go on some interviews of like non-academic jobs. So like I think it's just important that you know what you're saying yes to. So even like while I thought that's not for me, like it made me when I started this job be like, okay, I chose to be here. Because I'm sure like all of us have things that we don't like about work more than what we just said. And like that's normal and true of like, I think any job. But I think it has been helpful for me to always be like, okay, well, I saw actually what these other jobs looked like and I chose this. And I can still switch if I want to, but I at least like it let me see more than just what I saw in residency. Because I think probably as residents, most of you as primary care probably see people more like me than like the community aspect. And like realistically, there's such a wide variety of what your day to day can look like.
So as a resident, I would say, whenever you get an opportunity to do procedures, I would say grab it, because even though, probably I think in recently, ACGME changed the need for certification, as to the arterial lines, central lines, intubation and whatnot. But that is my personal experience, because as you get to do this procedure, if you're comfortable, you become more confident. And as you look for jobs, probably in your PGY3, at least 6 months, and narrow down where you're going, know the resource limitations that where you're going. Are you comfortable with that? Like, simple things like, is it open ICU, or if you're becoming, inpatient hospitalist, of course, this all applies to. Is it an open-based ICU, or, closed ICU? Is it a semi-ICU, like wherein, the intensivist is only available, or the critical care doctor is available only for a few hours, and the hours that are not available, are comfortable in managing that patient? Are you able to do the procedures like, emergent intubation if you're trained? Or, as I said, I am also a early career physician and graduated at COVID peak. So when I was at PGY1, my attendings used to and the fellows, the patient used to get wronged, and other patient used to the same patient would get a dialysis line. And as a resident, I was doing a central line. The fellow was doing a dialysis cath in the femoral area, and then patient was getting wronged by the attending. So I felt as I progressed through my residency, when I had an opportunity to do more of the procedures, I didn't grab them. And as I, started looking for jobs and at places where I'm, possibly thought I will sign up, which eventually I ended up, when those when the resources are limited, I felt, I would have, as a resident, you have the cover, right? So anything you do is protected by that ending, and you have more leverage to, with the procedure. So I would say grab that as many procedures as you can. That will get you confidence. And if you're going to a place where there are limitations, you can, hone those and, be more confident and serve the community that you're doing.
I can piggyback off of that from the academic perspective too. I mean, we have, we usually have IR available, but still, I think there's a lot of benefit to having, good competency in procedures. We just rolled out a procedure service. A lot of academic institutions are starting to do them. It's a good opportunity to kind of do a, clinically adjacent role that's not direct patient care, that, kind of breaks up I think for me, I'm a clinician first, but I think that if I only did clinical medicine, which is sort of how my schedule used to be structured when I first came out of residency, I would burn out. And so I think finding ways to make yourself marketable to a hospitalist group, that you have skills that can, help care for patients that aren't necessarily just seeing them and taking care of them all the time.
Thank you for commenting on, right, how we can diversify ourselves as trainees for future opportunities, and also this concept of we're really not stuck in whichever job we pick, right? There are going to be possibilities, there are going to be ups and downs, and I really like this kind of affirmation concept of being like, well, I really chose this over something else. So I think that's really important to keep in mind. Okay, so I'm going to ask a last question, and then we'll have time for a Q&A. Um, and I'm going to combine two questions. And basically, I just want to hear if you feel you're happy with the field you chose, and what makes you happy about it. And if you ever, wish you had chosen something different, and how you navigate that.
I can go. I'm extremely happy with the field I chose. I think, as I mentioned, it gives me a lot of flexibility, my day to day. I get to do a variety of different roles. And I think probably the biggest thing, being academic, is I really enjoy working with all of you. I think the residents and our medical students keep me, at my bet, practicing at the top of my license. And that challenge is brings the biggest joy besides taking care of patients. And then I think, thinking about things that regrets. I don't know. I was very close to doing pulmonary critical care fellowship. I don't have any regrets not doing it. As I mentioned, I think training during COVID had sort of a burnout effect on that desire. but I do think there is something to be said for expertise. I'm always looking for more expertise of my own. So I think like, having the ACGME teach you expert stuff versus, so for right now, I'm working on my certification in my critical care echocardiography boards. And that's all self-guided learning. And it would be nice to be in a fellowship with a little bit more structured learning opportunities.
I am like very happy with the career that I picked. I like moved institutions, moved cities for this job. And I like was really scared of doing that because there's a lot of change at once. Um, but I have found that like the more that I do primary care, the happier I am doing primary care. Um, and I like will now go into the hospital with the med students or like to visit my own patients. And I'm like, wow, thank goodness I don't have to come here every day, which is not how I felt when I first started this job. When I first started, I was like, oh, I kind of missed some of this. So like, I mean, I probably could have been a hospitalist and been really happy too. And I think I just was scared, and I'm glad I took that what I at that time what I perceived to be a risk of making all these changes.
I agree. I'm very happy doing primary care. I also feel really good that like I can do primary care in different ways, like if this is not what I want to do forever. But I know that I'm happy doing what I do, seeing patients, seeing them longitudinally. Um, and then I think that a part of me always feels like originally I was going to do a prelim year and not do a categorical residency, and then go to law school and kind of do like health policy work. A part of me always feels like maybe I should have done that, but then I always think about like the patient relationships that I have, and there's just no going back. It's the best part of my job.
I'm too affirmative. As I said, I am also, I mean, I'm very happy in my current role and job. I like that, fast-paced acuity, not the acuity of the intensivist, where you have to emergently intubate all the time or, at most of the times or, things like that. But that team-based approach, the autonomy that I have in a small community setting, and, the immediate impact, as I said, patient came in the other day in the ER for shortness of breath. And for lack of resources, I just went down and saw the patient was cirrhotic, has history of cirrhosis. I just did a the simple thoracentesis and took out 3 liters, and he was very comfortable. So that autonomy that you have, not waiting for other folks to care for your patient, that is something I like. And as to the I wouldn't say regret, but I was and I'm still a little curious about what the management side of looks at it. Fortunately, we are a small, we are a 6 or 7 hospital system based here in the upstate New York. And I have a mentor who is the system chief. So he kinds of, peeks me in the committees, and I have a sneak peek into those. But as I said, I love my job. Probably down in the future, that's the beauty and flexibility of as a hospitalist. You can be go into administrative role. You can just be a clinician. As one of my panelists, Dr. Rabinowitz, you can be a clinical researcher, things like that. So you have a lot of flexibility, and I'm very happy about the job.
I would say I'm personally very excited to hear that, such positive outlooks in what we can do after residency, in an honest way, right? Nothing's gonna be perfect, but I feel it's so great to hear you all today and share through different pathways in different settings how there's so much to do and how hopefully we're all gonna find a lot of joy from doing our job and helping our patients. So I'm personally excited about it. Thank you so much, honestly, for sharing all this information and your personal experiences. Um, I think we have a question in the chat, and I encourage you if you want to add any, or if you want to, just raise your hand and mute and ask any questions. But um, we definitely touched on this, but I guess and it's going to be connected to our future event on this series. But Tendai was asking any advice in terms of like how you begin the job search, connecting with the recruiters, or any networking.
So I mean, I there's a lot to it, so I am happy to talk more offline. I gave my email about sort of my approach, but in general, what I did was identified where I wanted to be, which was New York City, and what kind of job I wanted, which was an academic hospitalist job. And then I sort of went through all the major academic programs and identified who the hospitalist director was. And then, I think a lot of this is doing some digging on your own. I wish there was like a central repository. Maybe that's something that we can work on as the resident fellow committee. But I basically just asked around, people, word of mouth, how to get contact information for various hospitalist directors throughout New York City, and then sent them all a personal statement, my CV, and then sort of kind of trying to line up my interviews in the fall before of like late summer, early fall of my third year of residency. And then sort of went on the interviews and kind of started getting offers kind of in the late fall and made a decision by early winter.
I also sent a lot of emails. I texted like a lot of friends from med school being like, "Hi, I haven't talked to you in 3 years, but can you tell me this person's email?" Because it seems like that's who I should send my CV to.
I would say seniors are your best bet, as you narrow down, starting the lecture itself, what kind of work-life balance you like, want to be hospitalist versus, primary care. As hospitalist, there are resources for, Society of Hospital Medicine itself on the website. You can go in and, type in your the location and, what all the filters that you have, open ICU, closed ICU, subspecialties and all that. So there you can that is one area where you can start the search. Other is the NEJM. The website again has said itself as they send monthly newsletters and hospitalist roles or positions open if you sign up there for the newsletter. So those are the two main things that I used when I was trying to look for the job. And as I said, start early. So as you narrow down, probably at least 3 months in before you graduate, you can narrow down and then decide on which ones you want to go as you go through the options that you have.
Also, don't forget about your program directors. For those of you who have kids, like everyone says, the nanny network is like magical. The program director network is also magical, and everyone kind of knows each other and knows someone and this job offer and this opening and this niche field. So just talk to them.
Thank you. And if I may add, I've been navigating this process recently, and being on a visa is also sometimes a complexity. So if that's the case for any of you, kind of just giving yourself a bit of extra time, I think it always comes in hand, and it's never going to be a bad thing to do. Okay.
So do we have any further questions from the residents here? Anybody want to ask anything before we close up? I don't know if any of the panelists have any sort of final words. You guys have done such a great job already giving inspiration to all these learners about what kind of path they might want to venture down in the coming year or so. But if there's any sort of final remarks or you want to make a plug for your particular field or whatever, that'd be great. And I want to thank Dr. Perry as someone who was a program director for many years. I am very much a part of that network, and she's absolutely right. Talk to your PD. That can be a great way to find opportunities.
I have one plug for my own hospital, which is if you are somebody that really can't decide between primary care and hospital medicine, we do, I think we're one of the very few hospitals that do have hybrid roles where we have our primary care doctors do attend on the wards for, somewhere between 6 to 12 weeks a year. And they all love it, and they're really people that I look to a lot for learning about, how what happens after discharge, basically. And so I think they're a huge asset to our group.
I have two last things that I think are really important. Sorry, our town's fire alarm is going off. Um, don't be blinded by the number. I think it's really easy, like when you are ready to figure out what you want to do, to like get this really great offer and sign. And I think that the number doesn't equal happiness, and like you have to really make sure that the job for that number is something that could make you happy every day. Um, and the second thing, I'm totally forgetting. This is major mom brain. Sorry. What was I gonna say? It'll come to me. Sorry.
Thank you. I think that's actually a great piece of advice that when you start getting job offers, I think it really clouds your priorities. Um,
Oh, I
and I've had a
remembered it.
few
I remembered
people
it.
remind
Sorry.
me. Please.
Don't forget to advocate for yourself, because I also think that's something that I struggled with being a new attending in a practice. It was like, oh my God, can I do this? I was just a resident. I feel like the newbie. I don't know if I can ask for this. Can I do that? Can I ask for the day off last minute? Like there are certain things that like you are human, you earned this position, and you need to make sure that you know that and that your team knows that, because it's really easy to be bullied essentially. And so just stay strong.
One last thing I would add is, as you get your new wings and, starting to, practice independently and be that wonderful physician you thought of, don't overlook your own place where you got those wings, the residency where you did, probably you get opportunities from other places and you kind of run the numbers and you think, if you like other place, that's good, but just keep an eye that, the place where you got a residency also might still want to, look and work with you. So keep that as a whatever, if you want to look at as a backdrop or fallback, or just make sure that the team know that, the recruiters at your home place itself, that you might join them. So that way, if nothing works out, you have your own mothership to take care of.
I came back home and it was the best decision I ever made.
I never left, so
This is unrelated to that. But I would just say like the job, like applying to primary care and hospice medicine is very different than applying to fellowship. And I feel like it's like everyone's doing fellowship applications and interviews and talking about it. And then you're just like kind of off to the side being like, I think I'm doing something different. I don't really know what I'm doing. I'm sending emails. I think like finding people who've gone through the job process you can talk to about it and get advice from is really important, and is like very emphasized in specialties when like you have to get letters of recommendation. But I think it's equally as important for primary care and hospitalist medicine, because they're people who've like done the process, and it's it's just different. It's less structured. So I think having people to talk to about, and like the job offers that you're getting and the interviews that you're going on, is like equally as important, and just not always said out loud.
Great. Thank you all so much. I think you've shared major pearls with all of us, so we truly appreciate it. And we're pretty much on time. So thank you all for joining. There's going to be a recording of this online that you can also refer to and share among your friends and your residents, colleagues. We also have, as it was mentioned earlier on, two more webinars coming up in the future, and I want to plug Dr. Wolf to give us more information about that.
Yeah, so again, I want to thank everyone who was, for those of you who came to watch and be a part of this, but especially to our four panelists, Doctors Koransky, Ponnekanti, Perry, and Rabinowitz. It was really great. I think I learned a lot myself. I almost feel like I want to go out and find a job now. Um, but been there, done that. But in any event, I know the conversation was turning towards how to actually go about finding a job. And we're going to dig deep into that at the next webinar, which is scheduled for June 17th, which is going to be a similar panel to this. And we're going to talk about literally like the concrete steps that you need to take in order to, find that job that's going to bring you the joy and happiness that all of these people seem to have. I also want to make a plug for other NYACP things. This event was sponsored by the Resident and Fellow Committee. At the meeting that we hold in the fall is our annual Doctor's Dilemma. For those of you who don't know what it is, that is a Jeopardy contest. It's really a lot of fun for residents. Every residency in the state is welcome to put forward a team of four residents to come and compete, and the winning team gets a expense paid trip to that year's national ACP meeting to compete against the other 49 states. So it's a really fun, exciting event. And if any of you are interested, talk to your program directors, talk to your chief residents, and ask them to call this woman. I don't know what side of me she's on your screen, but Karen Tucker Labello, who is helping put that together for next October. And that reminds me, finally, to thank both Agostina, who is a resident and really had the idea behind this and ran it, and she did such a wonderful job. I want to commend her for that. And of course, the Karen is the backbone of everything that we do in the education realm here at NYACP and a lot of other things. So thank you for putting this all together. And I think that's a wrap.
Wonderful. Thank you, everyone. It was wonderful having everybody here tonight, and we will see you on June 17th.
All right.
Have a good night.
Thank you all.
Oh, Karen left. I thought we were going to talk, but great job, Agostina. That was great.
Okay, thank you. Sorry, there are a few. Let me see.